Welcome to September's Digital Team Brief. As I've previously mentioned, sharing important business and operational information about the organisation in this format remains the best way in the current environment. It won't have escaped your notice that over the last month or so, we have seen an increase in the number of people contracting COVID-19. We can see that from the daily test results published by the government, but also by our own data, which show an increase in COVID-19 emissions in recent weeks. We also expect a further spike towards the end of October. I would also like to make a plea to our clinical staff caring for COVID patients to use the shower and change facilities we have on site. Here on screen are the locations across the site where showers and changing facilities are available. We are fitting digital locks to the showers this week, but in the meantime you can get a key from the security office, which is located at the back of Charlesworth building. If it's not possible to use these for whatever reason, then please shower as soon as you arrive home, because this will protect you and your family. Some of you will be aware that we've been recently visited by the regional infection prevention teams, where we walked them through our COVID and non-COVID care pathways. The team were overall complimentary with what they saw and were confident in our IPC practice. However, they did suggest some minor modifications which we're implementing immediately. We were also asked to improve our turnaround times for COVID tests, which we are undertaking in conjunction with our microbiology provider, Manchester University Foundation Trust. Although we achieve 100% compliance with testing patients as they are admitted to hospital, we need to ensure we undertake an additional swab test on day 5 of their hospital stay. In order to support this process, we're ensuring that we provide a 24/7 portering service on site to ensure we collect all the swabs from clinical areas in a timely manner. The HSJ Virtual Value Awards ceremony recently took place, where, as you will remember, we were shortlisted for no fewer than 15 awards. I am delighted to tell you that out of those 15, we won 2 categories, which is really fantastic news for the teams and the organisation as a whole. The winners were in the acute service redesign and specialist service redesign categories were the integrated urgent care team and the place-based paediatric team. I would just like to say a huge congratulations to all those shortlisted entries. A great deal of time and effort went into those submissions against a backdrop of intense pressure with COVID-19, so I'm really pleased with our achievements. We have another HSJ Award ceremony to look forward to in November. Again, that will be virtual, and we will have a number of shortlisted entries for that too, so fingers crossed. The survey is just over a month away, and I would like to take this opportunity to remind colleagues of how important it is to get your views and thoughts on how we can improve as an organisation. 2020 hasn't been your average year, and it will be interesting to see feedback on how we can make working lives better. Please look out for our direct communications about the survey nearer the time. We are now officially in the flu vaccination season, with the vaccines arriving and the immunisation plans being rolled out across the organisation. It goes without saying that this year is a very important year for us, as we have seen firsthand what viruses like this can do if they can take a hold. I would urge everybody to get booked in for a jab as soon as possible. Let's make this a year where we get 100% of our staff vaccinated and set a good example. We mentioned recently in my blog about how plans were shaping up for the reconfiguration of our emergency department, and I'm really looking forward to being able to share the designs with you in the coming weeks and months. As you all know, we have secured a significant amount of funding from the government last year to improve our ED offer, and will create an environment more suited to the needs and demands of our patients. Furthermore, it has been recognised that with the increasing pressures on our hospital, especially with the pandemic, that providing adequate waiting space in our A&E department while still maintaining social distancing is a real challenge. As such, we are currently in the process of providing a temporary extension to the existing A&E waiting room to relieve the immediate pressure the trust is facing. In order to extend the waiting room, we will be installing 2 new modular units in the A&E drop-off area and then break through from the existing waiting room to create one larger area. The work also includes the relocation and alteration of the entrance ramp, as well as the diversion of drainage channels and associated chambers. While the extension of the waiting room appears to be relatively straightforward on paper, there are a number of challenges which we have to manage. These include maintaining access to the existing A&E reception via temporary entrance and ramp, clear access under the canopy for NWAS, as well as ensuring that our A&E colleagues can still navigate patients correctly as part of our COVID management. The recent weather has also posed challenges, but unfortunately, this isn't something we can project manage. The contractors, as well as our internal teams, are working incredibly hard to get the extension installed and operational as quickly as possible in the next few weeks. Whilst I'm on the subject of the emergency department, I wanted to mention plans to introduce a new service called 111 First, which for us will become available at the end of October. During the recent lockdown, we saw numbers presenting at the emergency department significantly reduce, with only those people who really needed urgent or emergency care being seen. The NHS would like to continue this trend, and as a result are rolling out a triage-focused emergency department service where patients will call NHS 111 first and then be directed to the most appropriate service for them. In some cases, this will be ED, and in others, it might be a service in our community or something their GP can help them with, or perhaps a visit to the local pharmacy. We're also ensuring we link this new development with our own digital health hub. Finally, I'm really pleased to tell you that we've appointed a new head of fundraising, Kate Ledbetter, who recently joined us. Kate's task is to continue the fantastic work started by Angie Wild and drive our scanner appeal funds upwards to the goal of 1 million. Please remember that any contribution, no matter how big or small, to the appeal is very well received, and we really appreciate all donations. Thank you again for watching this digital team brief.